Airborne precautions. Airborne precautions are required to protect against airborne transmission of infectious agents. Diseases requiring airborne precautions include, but are not limited to, measles, severe acute respiratory syndrome known as SARS, varicella, which is your chicken pox, and Mycobacterium tuberculosis, TB. Airborne precautions apply to patients known or suspected to be infected with microorganisms transmitted by airborne droplet nuclei. Preventing airborne transmission requires personal respiratory protection and special ventilation and air handling. How airborne transmission occurs. Airborne transmission occurs through the dissemination of either airborne droplet nuclei, which are small particles, 5 microorganisms or smaller, of evaporated droplets containing microorganisms that remain suspended in the air for long periods of time, or dust particles that contain an infectious agent. Microorganisms carried by the airborne route can be widely dispersed by air currents and may become inhaled by a susceptible host in the same room or over a long distance from the source patient, depending on environmental factors such as temperature and ventilation.
Okay, now we discuss shoe and head covers. Shoe and head covers provide a barrier against possible exposure within a contaminated environment. Shoe covers. This is a shoe cover. It provides a barrier exposure to airborne organism or contact. And this is the shoe cover. We demonstrated my shoes. You just put it on. We also have head covers. They protect the hair and scalp from possible contamination with sprays or airborne anticipated exposure. This is a head cover. You stick your hair up under there and everything is covered up. Okay. Right. We also have face and eye protections. Your facility may have goggles or the face shield, which I previously demonstrated to keep you from splattering of your eyes, and you would just put them on as if it's glasses, keep any splatter. And the face shield, you would put it on the exact same way, put it behind the ears, nose and mouth, and it would cover their face from any type of splatter such as urine, blood, feces.
Recommendations for donning PPE. Always perform hand hygiene before donning PPE. If wearing a gown, don the gown first and fasten it back accordingly.
I like to tie my gown first and just kind of slide it over my head.
If wearing a face mask or a respirator, secure ties or elastic band at the back of the head and or neck. Fit snug to face and below chin because she's wearing the respirator. If she was wearing a face mask, she would make sure the flexible band fits to her nose bridge. If wearing goggles or face shield, put it on face and adjust it to fit. If wearing gloves in combination with other PPE, don gloves last. Recommendations for removing PPE. Remove PPE before leaving the exam room or patient environment except respirators, which should be removed after exiting the room. Removal of gloves. Grasp the outside of glove with the opposite gloved hand and peel it off. Hold removed glove in gloved hand. Slide ungloved fingers under the remaining glove at the wrist. Peel off and discard. Removal of gowns. Remove in such a way to prevent contamination of clothing or skin. Turn contaminated outside surface toward the inside. Roll or fold into a bundle and discard. Removal of face mask or respirator. Avoid touching the front of the mask or respirator. Grasp the bottom and the ties or elastic to remove and discard. And also remove your goggles or face shield. Avoid touching the front of the goggles or face shield. Remove by handling the head band or earpieces and discard. Always perform hand hygiene immediately after removing PPE.
This is a case scenario. A patient has been admitted to the hospital as a direct admission from the neighboring clinic. The patient arrived to the room immediately during shift change. The outgoing nurse did not receive a thorough report and communicated the limited information to the oncoming nurse. Upon entering the patient room, you, as the primary caregiver, wash your hands and introduce yourself. You inform the patient that you are the primary nurse on duty. The patient states to you he is having chills and feel that he has a fever while coughing continuously while he reports his symptoms. What would you do?
We hope that you have received a some thorough information in regards to the appropriate use of PPE and our standard precautions and infection control precautions. We also hope that we've used very interactive activities to keep you engaged in our presentation. Now we want to go over the review the post-test and see if the post-test now, if you can address some of the answers in the post-test based on what our information we provided. Standard precautions mean treating the blood and body fluids of all patients as if they are infectious with HIV or hepatitis. This would be true. After you remove your gloves, wash your hands for 15 seconds with an antiseptic soap and dry your hands completely. This would also be true. We did say at least 20 seconds, but 15 is the minimum recommendation. Personal protective equipment includes headgear, mask, gloves, gowns, shoe covers if needed. A 54-year-old homeless man came into the emergency department with symptoms of a cough times 2 weeks, fever, night sweats, and chills. The doctor states to place the patient on isolation until the results from his AFB test are available. Which type of isolation precaution would the patient be placed on? This patient sounds like he has symptoms of TB, so he would be on airborne isolation, which is the N95 respirator. Finally, a 16-year-old student complains of body aches, cough, fatigue, and congestion. The school nurse did a flu swab and the result was confirmed positive for influenza. What type of mask should the nurse place on the student? This patient sounds like they have the flu, and they will be on respiratory isolation, which will be your face mask. We hope that you've gained some valuable information, and this does conclude our personal protective equipment teaching strategy for our Nurse 666 course. Thank you so much.